Center Test Prep Exam EOC. Question 1. The priority patient for a trauma team activation based on mechanism of injury is Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 2. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with Option A scalp laceration. Option B. An orbital wall blowout fracture. Option C. A nasal fracture. Option D. A mandible fracture. The correct answer is option B. An orbital wall blowout fracture. Blowout fractures of the orbit involve the thin bones of the orbital floor or medial wall and often involve entrapment of extraocular muscles or injury to the globe itself. Question 3. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is Option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 4. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer Option A. Folic acid. Option B. Vitamin B12. Option C. Thiamine. Option D. Magnesium sulfate. The correct answer is option C. Thiamine. Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, common in chronic alcoholics. Thiamine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 5. Carbon monoxide poisoning leads to hypoxia primarily by Option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is option B. Binding to hemoglobin with higher affinity than oxygen. Carbon monoxide has an affinity for hemoglobin 200 to 250 times greater than oxygen. By binding to hemoglobin, it forms carboxyhemoglobin, reducing the blood's oxygen carrying capacity. Question 6. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates Option A. Allergic rhinitis. Option B. Nasal mucosal secretions. Option C. CSF leak, rhinorrhea. Option D. Sinus infection. The correct answer is option C. CSF leak, rhinorrhea. The presence of glucose in clear nasal drainage after head trauma confirms a CSF leak because CSF contains glucose, while normal nasal secretions do not. This is associated with a dural tear. Question 7. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. US citizens only. Option D. Patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 8. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. SD elevation in leads 2, 3, and AVF indicates an inferior wall myocardial infarction. The right coronary artery, RCA, typically supplies the inferior wall of the left ventricle in the majority of patients. Question 9. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A, diltiazem, Option B, verapamil, Option C, metoprolol, Option D, digoxin. The correct answer is Option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 10. A patient leaving against medical advice, AMA, must be informed of Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is Option C. The risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 11. To calculate cerebral perfusion pressure, CPP, the nurse needs to know Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP ICP. A normal CPP is 60 to 80 mm/Hg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP. Question 12. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is Option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 13. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is Option C, tachycardia. In the early, compensatory stage of shock, the body attempts to maintain cardiac output and perfusion. Tachycardia and peripheral vasoconstriction are key early compensatory mechanisms. Question 14. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotalidase. The correct answer is Option D, administration of antivenom, crotalidase. The definitive treatment for significant pit viper envenomation is antivenom. Outdated first aid measures, ice, incision/suction, tourniquet, can worsen tissue damage. Question 15. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is Option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 16. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. A massive pulmonary embolism increases pulmonary vascular resistance, which can cause acute right ventricular strain and failure, acute cor pulmonale, due to the increased afterload on the right ventricle. Question 17. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option C, immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 18. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, vanticholinergics, option B, sympathomimetics, option C, cholinergics, organophosphates, option D, opioids. The correct answer is option C, cholinergics, organophosphates. The classic sludge M, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis, presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. Question 19. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid-position and fixed pupils. Option D, constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 20. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all for fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 21. The antidote for acetaminophen overdoses. Option F, naloxone. Option B, N-acetylcysteine. Option C, flumazenil. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion. Question 22. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 23. Priapism is a urological emergency characterized by option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option A, painful, Prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 24. A patient with a Le Fort 3 fracture is at highest risk for: Option A, dental malocclusion. Option B, airway compromise. Option C, corneal abrasion. Option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. A Le Fort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 25. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, ETCO2 of 0 mm Hg. Option B, persistent ETCO2 waveform with each ventilation. Option C, ETCO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ETCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flat line reading suggests esophageal intubation.